Hello, everybody. It's Jodi Franklin here, and I am absolutely thrilled to have again James Maskell on with me. And James, if many of you don't know, is the founder of the Functional Forum, which is the world's largest integrative medicine conference. And it just keeps growing and growing, which is wonderful. And I just love how James is so innovative. He's going to be talking today and giving you a lot of tips and points, but also just ways that you can make your practice more profitable in terms of functional medicine, and also how maybe how health coaching, having health coaches in your practice. I know a lot of people don't want to do it because it's expensive. You can actually profit from having it, and the patient outcomes are so much better when you have this service available to your patients. So this is really timely. I know in 2022, so many of us are trying to implement functional medicine into our practice. And James, thank you. Welcome, and thank you so much for joining us. But I was wondering if you could even just start right out by helping us to kind of understand how that you can use functional medicine in your practice now and have a profitable practice.
Yeah, look, I'm really excited to be here with all of you. And I was going to give a presentation, but I just said to Jodi before, like, I just want to have some real talk about getting functional medicine to be delivered in any situation. And I guess I just want to start by taking a step back. When we started the Functional Forum in 2014, it was a different world than it is today, right? It was a really different world. And I would say, what did that world look like? One, it looked like anytime any sort of integrated and functional medicine center would start in any major like hospital, there would be some philanthropy money that would get it going. And then once that philanthropy money kind of ran out, it wasn't able to stand on its own 2 feet because it was so slow and inefficient, right? Because the appointments were so long that like when the, money nerds who like decide what happens in the hospital looked at it, they'd be like, I don't know what this is, but let's get rid of it. And that happened at Continuum Center, University of Arizona, so many places, because the care wasn't being delivered in a way that was like feasible enough and organized enough to be able to be profitable enough to make it in that system, right? And then you've got, so that's on the systemic side. Then on the average sort of regular practice side, you've got practitioners who are trying to do it inside the insurance system. And it's just not well set up for it as well. You can only do small visits. You don't get paid for all the work that you're doing to like prep the case, all the extra work that functional medicine, that requires, to really dive deep with the patient, not really possible. And so you've got a lot of people trying to build a practice on insurance because it's easier to get the patients through the door. And, if you could only just make it work, like it's easier to make revenue. It's just not easy to make profit because like, you're making a small amount of money in a small amount of time, and it's just not well set up. So at that time, when the Functional Forum started and the evolution of medicine, we were like, just get out of insurance, right? Start your own low overhead practice, run it on cash. And that's the way to like give yourself the best chance of having a successful functional medicine practice. And like, I don't know how we're going to do it inside the system because like, I can't really control that. So that's the way that it was for a long time. And I literally spent a decade from 2008 to 2018. I was like really involved in helping doctors kind of leave the system, start their own practice, get rid of insurance, and just try and help people. And basically what happened is I realized like, one, that worked pretty well. Like a lot of people were able to build their own practice without insurance. But I think for many people, there was this sort of like heart feeling that they weren't able to help the people that needed it the most. And that was sad, right? Because most people who practice functional medicine, are healers. And as healers, it's frustrating to not be able to deliver it in a way to people that need it. Obviously, anyone that works inside any sort of hospital or big group or system who wants to help their patients in this way, tricky because they take insurance. And like, if you can't tell me how I'm going to make it profitable, I really don't want to hear it. Like if I'm the manager guy in any of those situations, right? So, so things were a bit stuck and we were really just limited to the sort of micro practice model, and that was fine. But I think a couple of things changed in 2000. It started, first of all, in my thinking, which was, the other big glaring thing, right? If there's two big glaring things about why functional medicine was not really working, one is the access, right? We weren't really helping the vast majority of people who needed this care to access it. The second piece is, do the people actually do the protocol, right? Does the patient engage to such a level that they have a long-term transformation, right? Where they're healthier 5 years out than when we started working with them. And what I saw and what I heard from many practices, and when I'd speak to health coaches and I'd speak to doctors and I'd speak to patients, friends of mine who I recommend to functional medicine clinics, the number one thing that I heard is like, this is so overwhelming, right? It's such an overwhelming prospect. I still drink Diet Coke, and yet I've got a list of, 20 new things that I have to do, all these lifestyle changes, all these supplements. And like, I'm feel like I'm at 0 and I need to get to 1, and you're talking at level 50. So that, that would happen too, because I've probably sent like 1,000 friends and family and other people who reach out to me on Facebook, like, who's the best doctor in Billings, Montana? And I'm like, okay, I'll find someone for you. And I don't really know, but like, check this out. So I would get that feedback as well. So wouldn't it be amazing if suddenly the world changed and there was a possibility to solve both of those problems simultaneously, right? Where you could actually have a level of care where patients would get better and, would have the best possible support structure to make the necessary changes to go on a long-term health improvement trajectory that you started. And second, that like people on Medicare and commercial insurance could get that kind of care, and you could just sort of sit there and orchestrate the whole thing and do it profitably. And that is possible today. And that's why I want to share with you about it too. And not only is it possible, but, if I tell you it's possible now, you may think to yourself, okay, there's a weird world of possibility where that's possible, but I could never operationalize that because I'm not like a legendary entrepreneur that's got all the details. Like, I'm not a detail-oriented executor. I maybe have tried entrepreneurship or thought about entrepreneurship, or I work inside a system. What I'm going to share with you today is something that is working to reduce the friction in implementation, because we can actually take a lot of the operational risk off the shoulders of the individual practitioner, or even off the like integrative medicine department in a system, or even like, the OBGYN system or the pain, program. Because, what I want to share with you is that we've developed a system where we can partner with you and take a lot of the operational risk off your shoulders. So let's start with health coaching and have a conversation with health coaching. As Jodi said, this is a critical piece, right? The difference between actually getting people to do the program. There's a lot of things that, just giving people an epic protocol is no guarantee of success. In fact, the bigger the protocol and the bigger gap from where they are to where they need to be, the more chance of total failure and feeling like guilt and shame and all these, negative emotions because, well, why can't I do it? Like, it's just there. They gave me the protocol. I paid all this money and like, I didn't get better, and it's my fault. And like, I'm useless. Like, patients are feeling that way. Definitely. And, the reason why the health coach is so valuable is because they can sort of be in the space of helping people really think through what it's going to take time to implement. But working out how to do health coaching in a cash practice has not been easy, right? You have to have enough of a pull as a provider to be able to get them not only to pay your fees, but to pay the fees of the health coach, which was not always easy, right? And then, like, it's not that efficient to be always there with the health coach. And I guess I want to take a step back to say, like, what is a health coach? Because like, a health coach is not a provider, right? And a health coach is not like the way that I see it is actually, it's sort of like halfway between a provider and a patient. It's that gap, right? Filling that gap. And what's interesting to me about it, if you look at the models out there of most effective behavior change, like what are the most effective models for behavior change? There's always sort of like a peer leader. Look at Alcoholics Anonymous, right? What facilitates the transformation in alcoholics, which previously everyone thought was incurable? It's the fact that there's that mentor character, right? The person who got clean, doesn't drink anymore, and is there to support you, checking in with you every day to make sure you didn't go to the bar, you didn't have a drink, right? And as I sit back, I think a health coach is really like that, but for reversing a chronic illness, right? If you're in the functional medicine business, you're in the business of reversing chronic illness. And in that way, that person, that mentor, that person who's done it before and is there to help you is almost like the key missing part in behavior change, because it's like someone who's not like the doctor, honestly, and even the practitioner, and in many cases, even the nutritional therapist and the doctor, the nurse practitioner can feel a little bit like, overwhelming. All the weird emotions to do with the medical system can come out. It's not really your fault, but it's real, and we need to sort of acknowledge it. So, I
just want to add, James, to
Yeah.
your point. I mean, so much of what you talk about with your patients is foundational, right? They need to know the right foods to eat. They need to be going to sleep at 10 o'clock at night. They need to be, controlling their stress, all these things that you could just repeat over and over again in your sessions and charge a fortune for, where the health coach is specifically trained in these lifestyle things. So they can take that burden off of you, right? To do that. And I want to point out one thing really quickly with to your point with what you're talking about. These are statistics that I know you put together, but this is from using health coaches in your practice. The success rate, right, goes way up.
Yeah, I mean, I'll talk more about like what it takes to get those kind of outcomes as we move along, but coaching and behavior change is a big part of it, right? If you can get everyone to make significant changes in the fundamentals of health, right? The sleep, the food, the exercise, the stress, the environment, like if you can get people to make changes in those areas predictably, you get those kind of outcomes. Most people have significant improvements in their health, and that's what we need to focus on. Diane Allen, I see your message here. We were taught that health coaches can be providers, especially if backgrounds in healthcare field and you're insured properly in your area. Look, a lot of people obviously come from being a nurse to being a coach, from being a nurse practitioner to being a coach, and they learn coaching skills. And that's great. I think it's amazing for providers to learn coaching skills. There's a big difference. In fact, it's actually almost polar opposites. Expert and coach are actually almost opposites, because the expert has the answers. The coach helps the patient to have their own answers. And you can build those skills for sure. And when I saw people like Dr. Shilpa Saxena, Dr. Jeff Geller, facilitate groups, they have learned something incredible. They've learned a level of humility. They've learned a level of like not having the answer, to be able to work with a group and bring out, to actively empower that group by not having the answer. That is not taught in medical school. That takes a massive reduction in it takes a huge dose of humility to operate like that. And by and large, when we've seen sort of providers go into the coaching direction, it can be tricky. But look, if you've a lot of providers are here in functional medicine because they've reversed an illness too, and that's like their origin story, and it's amazing. But I just want to think about if you could organize your practice optimally, have providers who could come up with a plan, right? Who could do the labs and the supplements and the sort of precision medicine element of functional medicine, and then have the coaches and the coaching structures work on the on the lifestyle behavior part. And then together you have the best standard of care. So let's talk about coaching for a minute and the insurance system. So as of today, coaching can be billed to insurance, but they are category 3 codes. And what that means is they don't get paid for by insurance, right? That is the state of the game today, billing insurance codes. However, there are ways to use the big changes that happened in coding in 2021. The biggest change in coding in history in the last 30 years came around. And if you think about it right, look, we can prepare ourselves. We expect that in 2023 or 2024, those health coaching codes will become category 1 codes, and you will be able to just get paid for health coaching. That is 100%, the way that things are going, because doctors like Cheng Ron and others who have accountable care organizations and are like tracking all of their data are showing these better outcomes with coaches. And eventually that data will make its way into CMS, and CMS will be like, well, we don't see many people across the country that are reversing their chronic illness, but these people are. Let's have a look and see what's going on. Oh, they're getting as much health coaching as they are getting provider visits. So that data ends up trickling up, and changes in CMS happen as a result of that, right? So it's coming in that direction. But right now, there are ways to be able to set up your practice, if you take insurance, to be able to get paid and make profit doing health coaching. And I guess I just want to start by saying that I believe that right now, if you looked, when I started at the beginning, I said, okay, if you looked in 2014, the smartness factor of taking insurance was low and the smartness factor of doing cash was high in 2014. I think that's flipped over now, because of these changes in health, in the coding that started in 2021 and have now continued into 2022. And that's, when the codes change and we're all entrepreneurs or we work inside the system or otherwise, if we know that the codes have changed, we can start to work within the scope of the codes to be able to create something very different. So I want to talk about what that structure is and how it works. And I also want to make sure I take all your questions, because, I know that there are a lot of questions about this. And I know also, maybe you guys could put in the chat below, what your situation is. Are you a provider that takes insurance? Are you a provider that doesn't take insurance? Are you a provider that works inside a system? Are you a health coach? Are you a practitioner, neither a provider, that you don't take insurance? I'd just like to know, because obviously functional medicine attracts all sorts, right? It attracts a lot of people who have had their own experience. So if you put that into the chat, just give me a better idea of who's here and what your situation is, so that I can tailor where we go next. But I guess
that's James, this group is all practitioner group. So this is all nurse practitioners, MDs, PAs, etc., nurses. Right. But I do want to say, before you continue, for anybody who is interested in this, in case you have to jump off early, James has put together a toolkit for your company if you want to present it to the administrator in your company, or anybody that may be, or if you make the decision on that kind of thing. There's a whole entire toolkit he put together for how to do this. So if you put your email, you can message my assistant, Terry Clanton. You'll see her on this thread. Give her your email, or if you're on the Zoom today, we'll send it to you. A copy of this toolkit, along with his book. You're going to get a free copy of his community cure book. James has been so generous in giving everybody a copy of that. So if you want to get that and you're watching on Facebook right now, just message my assistant, Terry Clanton, your email, and she will make sure that you get that and the toolkit. And, if you want to go ahead and do it, you can even book a call with James to talk a little more about it directly. Anyway, commercial over. Go ahead, James, continue. I do want to hear how to do this.
Well, look, so look, just to take a step back, I wrote that book in 2019. It came out in January 2020. The book is really like a step-by-step guide to anyone who wants to implement group visits. But what I've come to learn over and health coach driven group visits, because I firmly believe that coaches are an important part of group visit because of that peer-to-peer dynamic, right? Because of that mentor dynamic, because of that, not an expert dynamic, right? We've done a lot of experimentation in the last 2 years of groups. And what we found in general, and this, you may not be this, right? But what I found in general is that when providers run groups, their default is to lecture because you know so much. And so, but what we found is that lecturing is useful, like information transfer is important, but it doesn't move the needle on behavior change. Like if it did, I think we wouldn't have chronic disease in this country, because there's enough summits, there's enough books, there's enough podcasts telling everyone to be healthy. But clearly that's not making an impact at the level that we needed to make an impact. If it was, we'd already be there in a certain way, right? So it's about really creating, transformation in people. And to create transformation, you need mentorship, you need accountability, you need support, you need trust. Actually, what you really need is people to just calm down from the craziness of the world out there, have some space to be able to just like take baby steps. And ultimately, when I wrote that book, it came out in January 2020, and then the whole of group medicine was destroyed overnight by COVID. Not just the fledgling functional medicine groups at the Cleveland Clinic, but like Alcoholics Anonymous and addiction groups and all these other groups are destroyed because you couldn't be in rooms together. And so we started to think, okay, is there a place for virtual groups? And let's just try this out. And over the last 2 years, essentially what we've done is we've tried it out. We've shown that it works, and we've developed not only an optimal system, but we've developed a system where we can partner with anyone that takes insurance and facilitate the groups ourselves in partnership with you. So there's a role for the provider, right? The NP and the PA and the doctor has an important role because you're important for insurance billing. You're the one that creates access for this in Medicare, very soon Medicaid, and commercial insurance and workers' comp. Right? Your license and your insurance contracts create that access for the majority of people. But ultimately, what I've realized, having been a practice management consultant and releasing this book and trying to get people to do groups forever, my TED Talk was on groups in 2015. So I've been on this for a long time. It's not the thing that stops clinics from getting the results of these coaching groups is by and large operational risk, messing it up. And it's not the doctor's fault. It cannot be the practitioner's fault. It's no one's fault. I see a lot of resistance from front desk people, right? Doing everything new, right? Trying to do something new in the practice. I see a lot of resistance from doctors like, well, what happens if people start talking to each other and I can't control it? Like I've never, there's a lot that goes into it. So, what we've created at Heal Community is a structure where essentially we can partner with organizations that take insurance. The practitioners can do what the practitioners do, which is establish care, prescribe the group, be available in the groups for the insurance billing moment and bill the insurance. And then we'll take care of everything else, hiring the coaches, training the coaches, delivering the curriculum, having the technology hub, customer service, tech support. When Janice calls and is like, oh, I don't know how to use Zoom, can you help me? We help them, right? It's not like you have to add another thing that the front desk has to do. So this is what Heal Community is here. And, we've created a structure that facilitates that. And so let me just give you an overview of what that looks like. So first, it's run by health coaches. So the coach is facilitating the Zooms and is connecting. One of the things I wanted to share, what we learned when we moved from an in-person group to a virtual group. I think none of us would ever rethink that an in-person, if you compared just an hour and a half Zoom, right, to an hour and a half in-person group, you would obviously realize that maybe the in-person group is superior. However, if you're talking about a 6-month episode of care, which is like how long it takes to someone to reverse a chronic illness, what we found is that if you have these Zooms interspersed with a sort of a Facebook group-like interface, right? Not Facebook, obviously, because we want to be HIPAA compliant. Very important to make sure that we've crossed all those T's and dotted all those I's if we're going to bill insurance. But if you have something like that where patients can connect 24/7 during the 6 months in an asynchronous way, and then regularly you get them on Zooms and you get them on one-on-one coaching, what we found is that virtual is superior because you can get people to engage with the content, with the groups every day. And every day, little touch points is what really creates a transformation in health. That's how you get people to have momentum to do new things enough consistently to get the outcomes that you showed earlier. So those outcomes that you shared are really like what the outcomes that we've seen from these 6-month episodes of care. In fact, those outcomes are from the first 3 months of the 6 months. And, that comes from delivering, a full biopsychosocial approach. right? Where you get people in the group, you have them calm down for a month to set their SMART goals, to meet each other, to build trust, to meet their progress partner, to connect. And then 1 month at a time, build one new habit in food, one new habit in stress, one new habit in sleep, one new habit in movement, one new habit in environment. And you add those up together over 6 months, and that's what you get. And that is doesn't include any supplements. It doesn't include any labs. It doesn't include any deep dives. That's what providers can do, right? You can do that. Some of the most exciting things that we've seen is like we've worked with a number of nurse practitioners that they are the functional medicine department in their group, right? But they're full. And everyone wants functional medicine, and they're full. And you know, their boss is telling them, wow, I wish we could do more functional medicine because everyone wants it, but like, you're full, what are we going to do? And it's not that profitable because you're spending too long with patients. What are we going to do? The answer is you're going to complement your work with these virtual groups and deliver a lot more profitable care that can actually, compete on RVUs with stents or whatever other things people are doing still in fee for service.
Right.
So I want to just sort of leave it there for a moment, Jodi, and just, maybe we could deal with some questions, and then I can get more specific into what it is as people bring the questions.
Definitely. And I think you're so right, James. I mean, functional medicine sometimes gets a bad rap because I remember my first experience, I brought my daughter into a functional medicine practitioner, and she was lovely and I thought she was great, but she gave her 50 recommendations to do. And my daughter walked out of there and said, like, hell, I'm going to do all this. It was just so overwhelming. Whereas a lot of it was foundational, and having a health coach to walk her through, she could meet once a week with a coach, keep them accountable, keep them going on those lifestyle changes. You get huge changes. And I don't think those numbers are exaggerated at all. What I've seen in my practice with it, it's been amazing meeting with people over time. Because as practitioners, you can't do that unless you're charging a huge amount of money, and it becomes an elitist game, right? It's not available for the masses, really, and that's I think why so many people got into medicine in the first place. They don't want to just do it for the elite; they want to help everybody, right?
Absolutely. So let's get into it. I mean, I see some. Let me do some questions here, Terry, because we got some Jodi. I mean, we got some questions that Terry had sent me that she had seen ahead of time. So we had one question. I'm a DDS. I treat TMJ disorder and OSA through medical. Would any of these billing coaching practices be billable through me? The answer is I don't know. What I have found out is that surprising types of practitioners can do this. We actually have podiatrists, lifestyle medicine podiatrists running these groups. So the key question is, can you bill a 99214, right? If you can bill a 99214 for a complex office visit, then you can probably do this. That's really the answer to that question. Okay, next question. As an NP, how do you bill insurance with health coaching, or do you simply charge cash for the coaching portion? No. The way that we do it in our system is, as the NP, you would prescribe this 6-month group episode of care to your patients. In that 6-month episode of care, they would have a 6-month coached experience through the portal and through these Zoom sessions. The Zoom sessions happen about once a month. And in those Zoom sessions, you as the nurse practitioner would be essentially in the breakout room of the Zoom, taking patients out of the 75-minute Zoom one by one to fulfill the billing criteria, and then putting them back in the room as the sort of like the group is being engaged over the month. That's how we've sort of managed to work out a way to do that. And the good news is that each one of those segments, those 7 segments over 6 months, each of those is very profitable for the clinic, right? So in fact, why don't I just, if you sign up to put your email, I'm actually going to send you this this document, and in here it talks about how it works. It talks about the structure, but like over here you can see that if you can start a new group of 20 patients every month, that would be a steady state revenue to the clinic of $6,000 to $9,000. Really depends on what your insurance pays for a 99214. So if it's at the top end, 150, you can make 9,000. If it's at the lower end, 120, make about $6,000 a month. If you can start a group every other month, then it would be, about 3,000 to 4,500. And if you can start one every quarter, it could be 2,000 and more. Some clinics that we're working with, when you get into allopathic medicine, the volume is just amazing. So we can send you this document so that you guys can see it and connect to it here. I'm actually just gonna,
those are huge profits. That's wonderful. I mean, it could pay your overhead for your clinic and, allow you to expand and do even more functional medicine.
Yeah, and if you could start a clinic, if you start a group every week, I mean, we have a rheumatology group in San Antonio. They see 800 patients a week. Could you not get 20 out of those 800 patients into groups? That steady state would be more like $24,000 a month of regular income. If you started one, every week for a year, that's the kind of, revenue that can be created. The other value for, say, when I mentioned the nurse practitioner who's in a clinic by themselves, you're able then to concertina all of these 20 patients into one 75-minute slot per month so that you can open up more time in your calendar to see more people for your sort of classic functional medicine visit. Okay, what's the cost for patients? Many have high deductible and no insurance. If you don't have insurance, this is not really something that we can do. With high deductible plans, the good news about our model is that it creates real transparency, because essentially all you're doing is having a visit every month. And people know what their cost is for a visit. Sometimes it's zero if it's Medicare. Sometimes it's zero if they have great insurance. Sometimes it's a copay. If you have patients with a proper high deductible with no, reduction on visit costs, it may not be a fit, because they will just be paying whatever that visit cost is, for a week. But they're getting a 75-minute visit. So even if you had to pay $100 for that, because that's what the insurance, or 120, some people may find that to be valuable if you're getting that long of an appointment. What if someone wanted to work with Heal Community as a coach? Are they hiring coaches? Yes, we are hiring coaches. So you can get in touch with us at Heal Community if you are. What level of practitioners can bill for services? So, nurse practitioners, obviously, physicians, MD, DO. We do have a podiatrist working with us now, nurse practitioners in private practice, obviously NPs and PAs who are like incident to the physician is your classic sort of situation. But, ultimately, I know there are some states where PAs can practice independently. Obviously it really depends, all of those factors will affect the revenue from the 99214. But that's the sort of range of practitioners. What would be the barrier for healthcare provider to hire me if I speak with an accent? I'm not sure if I can help with that. I speak with an accent, right? But that seems to have helped, but I don't know if I can help with that. How do we bill in health insurance for health coaching? Can it be set up to run through an online platform from any location? Yes, that's really what we're talking about here. Essentially, by prescribing an episode of care in partnership with Heal Community, the patients are going to get group coaching, ongoing coaching, one-on-one coaching, all inside this episode. And, it's profitable for the clinic. And because we don't do any of the like supplements or lab stuff, it allows you, the provider, to really focus on the sort of fun, sexy, interesting part of functional medicine, which is, getting to the root cause with some of your more advanced tools. Ultimately, what we're focused on is just getting people to actually make those kind of changes. I would like to understand if coaching programs can be created as a package for which people can just download and start following. I mean, this is exactly what this is. So, it is a 6-month program, and we take all responsibility for enrolling the people, calling them, having them understand what they need to do. As soon as we started working with Medicare people, we realized we need to have a physical workbook. So we have this, guidebook, which is essentially this is kind of like the learning management system. Our average age of a patient is a 57-year-old woman, and everyone loves to have something physical to go through. It's not all on the computer. And in that way, it's kind of in your house too, right? It's actually in your house. You're looking at it. It's a kind of a reminder, as we go along. The next question is, can it be cash pay? It can be cash pay. What we found is just that, for an individual practice, if you're cash pay, selling enough people in a short period of time that essentially they would be able to do it as a cohort is not necessarily, we haven't seen that happen that regularly. We are working on a way that you might be able to just prescribe it to one patient at a time, and we'd have a cohort with cash across different clinics. We can't do that with insurance. We are thinking about that, and we've got some partners that we're thinking about to really make that easy, but I would say that's probably coming later in the year. Ultimately,
if they have a cash pay practice though, and they do take insurance, they can do it through the insurance piece of it though.
Yeah, absolutely.
If you're 100% cash pay, you can't.
You know, yeah, exactly. You know, I would say if you ask me, what is the optimal model for the delivery of functional medicine moving forward? My thinking is now this far into it, and with that, where the state of play is, I think you want to have a wide funnel that takes insurance, some part of it. I think that maybe you don't, as the main functional medicine provider, you don't necessarily see those patients. Like I've seen a couple of clinics that run it like this. They have a primary care, you know, sort of ish wide funnel, which means that you take all insurance. They have an NP or PA or another physician who sees those patients. At the same time, they're like introducing people to these ideas of functional medicine. They get them in the office, there's brochures, there's front desk people, they're educating them. And then they have some sort of way to say, hey, look, you know, you've got some issues here that I think need a deeper dive. Have you seen this part of our practice? And here's the sort of high ticket cash functional medicine practice, which might be like a 3-month or a 6-month episode of care and include some labs and include some things on that end. And let me just give you an example of that. So I'm happy to be a little vulnerable here. So if you watched the Functional Forum last month with Dr. Perlmutter, I've had gout for the last few years, and it's not, you don't get a lot of sympathy for gout, right? But you know, I've had it. So, you know, it's funny that like my gout got worse as my lifestyle behaviors got better, right? So I don't drink anymore. Like I used to drink more when I lived in New York, and now I'm like a dad and I hardly drink. Right. But my gout got worse. How is that possible? Well, it's possible because we did the functional medicine test and saw that I had like a CFO fungal overgrowth, and, you know, changes in the microbiome can lead to overproduction of uric acid. Who knew? Well, that's the beauty of functional medicine. And even though my lifestyle and behaviors have got better over time, the gout still continued. And without that functional medicine test, I wouldn't have known what was causing it. So there will still be plenty of people that need to go deep with you. Ultimately, what we're doing is just sort of replicating what you see in the Cleveland Clinic Center for Functional Medicine, is that everyone comes through the lifestyle behavior change part first, because half the people will get better without seeing the doctor. Right? That's what happens at the Cleveland Clinic. They come into these groups, they get in these cohorts, they become friends, they build new habits, and half the people get better. So you can replicate that either in your practice, in your hospital system, in your group. One of the most exciting things happening in my life right now is that I'm in conversations with big health systems who, you know, who have real problems right now with, you know, staffing, right, with capacity. And we're able to come in and be a partner for them and help them build capacity and ability to, you know, bill more people and help more people. And so it's like a weird way that the COVID world has sort of allowed that. So, you know, even if you're listening to this and maybe you want to do functional medicine and you work inside a big group or inside a hospital system, that asset that Jodi mentioned earlier, we've created that as something that you could go and give to like an office administrator and say, hey, I think we should do this in the practice.
And especially if you're an allopathic practice, right? Because I think this model, even to your point, you have so many more patients that you're working with, it could really bring in a lot of profit. And, you know, you lead with that, it'll bring profit to the bottom line, let alone the incredible, you know, patient outcome improvements. It's like, it's a win. What is the downside? There is no downside to doing this, right? I think it's just a big win-win for everybody.
I see a question here from Johnny Kemp. It says, do you help with a collaborative practice agreement for an RPH? Oh, a pharmacist, right? Is that what you're saying? Yeah. So, yeah, I mean, possibly. I don't really know exactly how that would work, but yeah, I mean, I think that's possible. I think if a pharmacist can work, I know in some states a pharmacist can work sort of underneath a doctor and be sort of a billable provider under there. I think in Ohio that's possible, but I don't know. It's different from state to state. But yeah, look, let's if anyone has other questions, you can put them into the chat right here. And I'm happy to, to answer it.
Somebody asked if it's like instead of using Practice Better. That's completely different. That's a practice management tool software. It has nothing to do with, that's if you're in a cash pay business. We have a talk on that in this group. If you want to search Practice Better, you can see my video on that, but it's really not the same, not in no way the same thing. This is actually bringing health coaches into your practice. And
you still need an EHR to run your practice, and so, Practice Better is great. I think it's a good solution. Ultimately, what we do is, so typically how this works is that if a clinic is interested, we can chat about it, just make sure that it's a good fit, make sure you have all the pieces in place, right? The marketing, because you have to tell people about the groups, who's going to be the provider, and who's doing the billing. So we can train everyone. We typically have about 6 to 8 weeks from the moment that we decided we want to do this together to the first group. So we can train everyone and have enough time to recruit people into the groups. We've had some clinics where they've got 60 people. And so we put them in 4 groups of 15, right? We can create, we like to have between 13 and 20. 20 is ideal, but sometimes if you have I think we had 63. So we put people in 4 groups of 16. So we'll work that out. And then we just work with your team. So we're just trying to make it as easy as possible. We're trying to take all the operational risk and details on us because we know how to do it. We've got a really tight team. We've really, created a good structure. And then ultimately, this should free up some time in your calendar so that you can work with more people doing the precision medicine stuff. Or you can just take some time off. You can have some steady state income that doesn't have to come through your work. One of the crazy things about being a health entrepreneur, right? Just think about, I don't know if you guys have read the E-Myth, the book, the E-Myth, but if you were any other type of practitioner, if you were any other type of profession, let's say you're a plumber and you start a plumbing business, how long into that business do you not have to do the plumbing? After a couple of years, you've hired another plumber and you're just at home, signing the deals and having a good life. In medicine, because you're so valuable and you're a provider, you end up having to be the provider too. And that's why practice management can be hard. Operationalization of systems can be hard. And so what we saw as an opportunity when COVID came along was to really operationalize groups on behalf of clinics, where we could essentially provide groups as a service so that your patients would get better and everyone be healthy. I
want to bring up one point, James, and I love the fact that you guys vet the health coaches. You vet them, you pick the probably really top class that want to go to work for your organization. And the certification, the thing is with health coaches, you don't even have to have a certification to be a health coach. Anyone can call themselves a health coach. It's the wild, wild west. There's no standards. I actually happen to run the largest chain of health coaches on Facebook, also the largest group, so in addition to this group. So I know a lot about health coaching, and I will say there's a big difference in the level of knowledge between an entry-level health coach and somebody who's more seasoned. So I like the fact that you vet them, you train them, you make sure that they're doing things in the proper steps, the proper order. So don't try to do it yourself, I would say, unless you really know what you're doing with this. I would definitely reach out to James, get the toolkit. It's going to take you through step-by-step what to do. So just give us your email if you're watching this on Facebook. If you're watching this, you will automatically get it if you're on the Zoom, if you're registered for this. So you'll get the tool book. You're going to get a copy of James's book. And you can also book a call directly with James if you'd like to talk about implementing in your practice. So thank you, James.
Yeah, just one thing I want to just say to that is that not only, we've had a lot of coaches apply to work for us because we are providing full-time benefited salaries, even stock options for those people who come on full-time for us, because we want to build, something sustainable. We want to create an opportunity for people to really find a home here, at Heal Community for the long term. I would say, not only do we vet those coaches, but we've actually had to build our own training program internally, because even though there are great health coach training programs and functional medicine health coach training programs out there, but there's still a gap between one-on-one coaching and group facilitation. And that group facilitation piece makes a huge difference if you're running, this kind of model. So, not only are we monitoring quality and hiring, people who are experienced, who want to be part of a team that's really going to take health, coaching forward, but also, we have this onboarding training for all of our coaches so that when they work with your patients for the first time, they're going to definitely be awesome. And like, that's been something, like a lot of 2021 for us was just working out scalable systems, because like when we're going to partner with, hospital systems, ACOs, insurance companies, which is our plan for this 100% is already starting to happen. It's got to be good. It's got to be good the first time. It's got to look good. It's got to feel good. It's got to be high quality. We're representing the functional medicine industry, as well. So yeah, look, I would love to, if you are a practice that you bill insurance, or, I would love to, connect with you to just see if this is a good fit. And, I'm really excited. Just to give you an idea. So we are currently working with such a range of specialties. It's crazy. So we have pain groups, we have urinary incontinence groups, we have psychedelic therapy integration groups, we have gastroenterology groups, we have cardiology groups, we have all these different groups going on. The actual groups themselves don't vary that much, right? The sleep recommendations are going to be the same for all of those people, right? The movement is going to be about the same. So, what we've done is we've found ways, because the coach is unique. If we have a pain group, we'll be tracking the pain outcomes. We'll be talking about, pain as a biopsychosocial phenomenon. Ultimately, we are facilitating a range of groups. And, here's, Jodi, thanks for sharing this. We track all of the outcomes of all of the patients. So, what we've seen is that if the vast majority of people who have these issues, when they come in and it's serious, have relief from these issues. And that's because it's not just like, you might expect anxiety and depression if you're creating new friendships, right, to really connect people. But I think when we're making an impact on things like pain and fatigue, that's because we're delivering a biopsychosocial intervention, right? We're changing the diet. We're adding new habits with regard to meditation and stress management, box breathing, eating more veggies, like this kind of stuff. We're not dietitians. We're not prescribing diets to people. We're just helping implement the protocol that has been prescribed by the provider.
Love it. I think, they say like 70% of it's foundational. So this is just takes all the foundational stuff so you can concentrate on the important things with your patient and not have to go over the foundational things over and over and over again. I love it. Anyway, James, it has been such an honor to have you here today. I so appreciate it. It's such an honor, and great to have you on. And I wish you lots of success with this program. And one more time, if any of you want to get the copy of James' book, just give Terry your email. And if you want the toolkit that will walk you through step-by-step of how to go ahead and implement this into your practice, or to pass it on to a decision maker in your practice, please do give Terry your email. If you're watching this on Zoom, you'll get it automatically. If you're watching it on Facebook, make sure to get Terry your email on that. But thank you.
Thank you so much. Great to be with you. Look forward to hearing from many of you. I'm happy to, do another call if there's interest in it. Yeah, and I think just, that like, look, if I think everyone here in one way or another is not only passionate about helping the people in front of them, but are passionate about functional medicine winning, right? Succeeding, getting out there, getting to more places, more people getting access to it, more people realizing, hey, we were right all along. When it comes to chronic illness, like I would just say that like, this is definitely putting our best foot forward. The love, the connection, the belonging, all of the things that people feel from the groups is really special. And, and ultimately with the physicians too, this is unburdening them what's kind of sat on their shoulders as like, I'm responsible for these people making behavior changes, and like, I can't really control them, and I hope they're doing the right thing. But this sort of like burden we've seen just, speaking to doctors and practitioners, when they can take that burden off and put it on groups of people simultaneously, right? Where the group is now shouldering the burden. It just feels light and happy and healthy. And, the obviously the steady state passive income or partner income, feels good too, to be able to build strong, sustainable practices and help those with access here. So thank you.
I love it. Thanks. Take care, James.
All right, take care.
Bye, everybody. Thanks.